So let's say you go see your bodywork specialist, manual therapist, and whether that's chiropractic, massage therapist, osteopathy, fascial stretch therapy, the goals are similar. They're usually reducing strain, and another way of saying that is reducing pain quite often, as well as reducing immobility or increasing mobility, if you want to look at it that way. And these are very good goals. You should want to reduce these things, and so should that particular therapist. These are wise things to do for the health of the patient. However, what you might notice is that following the treatment, you can become very tired, and you, in fact, might have some pain in new places. This seems counterproductive a lot of times. It seems like it's the exact opposite of what you're going for, but you have to understand that a little bit of that, a reasonable amount of that, is actually a good thing. It's the body healing itself. It's the body taking a chance to fix a few things that it hasn't been able to before. And sometimes this is a bit of a necessary evil to go through. And there's some really reasonable reasons for this. So I'm going to throw up a few things here and try to explain them as best as I can. So let's start with the idea of strain in the human body. Strain, and when I say strain, pain is semi-synonymous. They're very similar things. You can have strain without pain, but usually they occur together. And it doesn't mean you're always aware of it, but that's just how it works. So with strain, it tends to occur in the longer tissues, the lengthened tissues. So when we're looking at the human body, understand that we move in curvatures. This is normal. We move in circles, really. Largely the whole body is all these circles and winding patterns, and it's really, really cool. But in a simple way, if you look at the curves, and this is, of course, a little bit of an exaggeration, but anything that's on the long side, what you would call a convex side, tends to be lengthened, and anything on the opposite side tends to be shortened. So any of these curves that go out this way tends to be long. And we can get way more complicated with this. We don't need to, though. But the long side, especially when you bend into it, so let's say we take this curve right here and we bend hard into it, we side bend, we lengthen it further, we lengthen it that much more, it really starts to separate. It starts to separate a lot of the tissues in the area, and there are many tissues in the area. There's lots of long tissues. For instance, there's all kinds of fancy names for them, but we have a longissimus muscle. Long tissue, longissimus, sounds good. We have shorter ones. We might call those deep intrinsic ones. They go in between the small parts of the vertebrae. They even go in between these parts here. And so if we're bending and we've got a tendency to already be bent to one side, we're going to start to really strain and pull into this area, especially if there happens to be a part that's really, really bent, that's really, really favoring this motion already. That's an important distinction. As we go further into it, we tend to pull those tissues harder apart, and we tend to create what is strain, which usually results in some kind of a painful experience. Again, we may be aware of it, we may not, but do understand this is damage happening in the body. And when damage occurs, we need a response. It tends to be a sympathetic response. Now understand, before we get to that, each of these strains, doesn't matter if it's here at the point of strain, if there's a lesser strain somewhere in around here, or even if there's, a medium-sized one way down here, understand that each of these are feedback into the system. It's communicating that something is wrong. Now, if it's just one, individually, it is very small. If it's just one little fiber, one little muscle that happens to be being pulled on, that is just saying, hey, ouch. That's not a big deal. Individually, not important. This can happen in the body, can be reduced pretty quickly. But globally, the whole thing altogether, if we have pain and irritation throughout the body from lots of different points, yeah, we're going to have a bigger effect, and this effect tends to build on itself. We've covered other videos, we've done other videos on that subject, the building pattern, the building problems in the body as we get into mechanical strain and the reaction to it. But understand, each of these is feedback. It feeds into the system. Each of these has a nerve that it communicates this pain, and it runs all the way up, all the way up, all the way up, and goes into the CNS, and it tells it something. In this case, it is alerting the body, and it's going to create a sympathetic response. This is what we know as the fight or flight response. And typically, this is something that's reserved for stress. It could be also called a stress response. Reasonable name because we react stressfully to it. And at this point, we consider it to still be a danger that we're responding to. So we respond as if something was trying to chase us or trying to hurt us. And so we change the way our body works because of that. So one of the things that commonly gets activated, and this does take a bit of time, but it's dependent on a few factors, is the adrenal glands. These release epinephrine or adrenaline, would be what most people know it as. And this changes the way the body works. To summarize, really, really simple, if we are under sympathetic, so under a sympathetic response, we change the blood flow by putting it more towards the muscles as well as the heart and the lungs. So when we do that, it means there's more blood being diverted to those systems. There's more blood going to that system, and therefore less going to the abdominal organs, our digestion organs. And this is not good long term. Ultimately, what that will do is result in unnecessary alertness. It's an unnecessary amount of fight and flight. The ability to run, the ability to essentially hit something really hard should we need to do that. And this is really a temporary response. We're not supposed to be capable of this in the long term. We shouldn't do it for too long because it's a detriment to our health. If we do it for a few hours, maybe a day at the most, it is sustainable, we can repair. But at one point, we must switch sides. So here's the thing. If we can reduce strain, we take this away, we can get rid of the long tissues, we avoid sympathetic response, we don't activate the adrenals, and we take out that alertness. What we can do instead is, instead of having blood going to our muscles, heart, and lungs, we can activate our parasympathetic nervous system. And in the parasympathetic nervous system, we put more of the blood flow to our abdominal organs, what we call rest and digest organs. This encourages restful activities, makes it a lot easier to do that. And as well, it means we can replenish our supplies because we're focusing on breaking up the food that we've eaten. We have more absorptive capacity. And so this encourages that system. So what you'll find is that as strain in the body is reduced, as we take away these tissues by unbending these structures, unbending these harshly held curves, for whatever reason they're there, we break down the tissue that's holding them, you'll find that it takes away this sympathetic response. We've been overworking for too long. We get rid of this alertness that was always excessive. It was excessive, in fact, excessive, unnecessary alertness. And when we drop that away, the communication is returned to the body. Normal communication about, in fact, how tired we actually are. Because at this point, we're quite tired. We're very tired. And it's going to tell you very, very loudly, your body. And you may feel exhausted for a few days after you get some kind of manual treatment. And this is normal. This is, in fact, a good thing. At this point, we can put the blood flow to the organs that recover our tissues, that replenish the supplies right down to the cell, and our health will be better overall because of it. Okay, Let's talk about immobility too. So understand, immobility is very much the opposite side of strain. So these things really do go together. They tend to represent the shortened tissues. So if we've got a curve on one side, let me get rid of some of this just to clean this image up a little bit. But if we've got a curve on one side, the convex side tends to be the strain. Well, it turns out that the other side, the shortened side or the concave side, tends to be the shortened tissues. So if they are bent like this, coming together on this side, the tissues between the vertebrae tend to be short. They tend to be pulling this way, like so. And you'll find, again, there may be some that are shorter than others. There'll be an apex to a curve. But all of the short tissues will be holding something. And this is actually usually what's holding the side of strain. This is the side you generally work on when you're trying to release a strain. Working directly on the strain, you can use, softening, inhibition, calming things down for sure. But if you really want to get that curve out and keep it from restraining constantly, this is the side you do actually want to work on. There's an intricacy to this. So these shortened tissues are shortened. They often stay there. What you'll find is that initially it may be contracting. We'll be getting a nerve signal from somewhere, CNS, again, and the local spinal cord from wherever will be sending some kind of a signal to say, hey, you got to keep going. You guys have got to keep contracting for whatever reason. That's a very complicated phenomenon. There's lots of reasons for that. But understand that it can be contracting. And sometimes if you give it enough time, if it stays in a contracted state, it will start to contracture. And not in the medical sense, not in the sense of like after a stroke, just in that the fibers will thicken and will become more rigid because they will have added a fibrous coating. It'll be extracellular matrix or ECM to reinforce the tissue. It really stops it from moving entirely, which is more stable but prevents further movement. So this is kind of a problem. Anyways, with that immobility, with those shortened tissues, eventually we start to lose sensation. So we get a dropping away of the sense of sensation, simply because sensation requires movement to occur. There's all kinds, especially with muscles, especially with joints, especially with the ligaments and joint capsules that surround these things. Every single one of them, again, whether we're talking about a capsule around the joint, we call a synovial joint, or if we're talking about the ligaments that surround these things as well, of which there are many, just as many as the muscles really, maybe a bit smaller, but they all require movement for sensation. So these things tend to cycle back on one another. As we lose sensation, we lose movement, and vice versa. These things go together. So this whole communication in the nervous system around immobility requires that. Now understand, as your manual therapist, or as you, the manual therapist, go in there and start moving stuff. You start wiggling it around again. You start going through those tissues and start reestablishing motion. It's not always going to go well. And oftentimes, just like you can feel tired after treatment, you can find that there's some pain in a new place, in a new location that you didn't have before. That pain starts to increase, especially, again, in some places they didn't think they were having pain before. And there's a few reasons for this. One is that it's, in fact, new sensation, brand new, at least to the body, because sometimes it hasn't moved in a very long time. If suddenly, your shoulders started moving again, or started moving in a very different way, it would be confused. Understand that if a manual therapist, a body worker, is going in there and breaking up some of that tissue, not forcefully, of course, doing it in a safe way, but they're breaking up that tissue, they're introducing motion that confuses the body because it didn't do itself, so it doesn't have a precedent for it. So it's brand new sensation, brand new movement. And so this is confusing to the system, and so it needs some calibration time. So it tends to, when it's confused, create pain. Totally normal. Another possibility is that we can have unequal resolution of the problem, of the restriction in motion or immobility. So let's say we have some kind of a muscle tissue, and of course it's striated, so that means it has a bunch of different fibers. And really, really simply, as that fibrosis or thickening comes in, it inserts itself. It's kind of wedged or wired or woven into those tissues. And so as we move again, as we start to loosen up, in many ways it's a chemical process, and there's lots of blood flow that actually has to come in effectively. There's lots of things that break down these proteinaceous structures. And when that happens, it doesn't mean it happens equally. In fact, you can have part of a muscle tissue resolved, but other parts of the muscle tissue simply have not gotten normal pliability back. So this part, let's say, is moving better, but we're not getting good motion through this part. That being said, the muscle will still move as a whole. It will still be asked to move as a whole, and so we can see strain and pain again occur in areas of high mobility around areas of low mobility. So it's an unequal distribution of the resolving factors. It means that the body is getting better, but it's not perfect to the point where it's pain-free. And ultimately, this leads to pain again. That's why you have to be careful about how much you move and how much you do after a treatment. You don't want to add to the strain you're already experiencing. But if you keep it slow, give the body time to rest, recover itself, and make the changes it needs to, ultimately it will reduce pain. It will actually get rid of that pain. And so we have to think clearly about what our goals are for the treatment, how our body's going to react, and how much time we have to give it to rest in between. These are all very important factors. So the truth is, no pain, no gain. It's not really a great explanation when it comes to how treatment works on the body, but a little bit of pain for a lot of gain, that's actually pretty reasonable. This has been Elge from Simple Lines Anatomy. Hopefully, that made some sense.